Healthcare delivery system. The healthcare system is becoming less service-oriented and more business-oriented. This causes issues as the focus becomes more about saving money rather than providing quality patient care. We have to develop methods of patient care that are safe, effective, and patient-centered while at the same time are timely, efficient, and equitable. Professional Standards Review Organization, or PSRO, reviews quality, quantity, and cost. Utilization Review, or UR, identifies and eliminates diagnostic and treatment overuse. Prospective Payment System, PPS, is grouped inpatient hospital services in diagnostic-related groups, or DRGs. There's fixed reimbursement for a specific illness or specific issue. Capitation is a fixed amount received per patient of health care plans. Managed care is preventative and maintenance care to contracted groups or organizations. A preferred provider organization, you have to use a provider on a provided list. Medicare is a national health insurance for those clients over age 65. Medicaid is national health insurance to low-income or disabled people. We know what private insurance is. It's what most people have. Long-term care insurance is supplemental insurance for long-term care. State Children's Health Insurance Programs is a national health insurance for uninsured children. And the Patient Protection and Affordable Care Act. The major goals of this are to increase access to health care service for everyone, reducing healthcare costs, and improving healthcare quality. It also includes reforms that increase insurance coverage and decrease cost. Excuse me. There's 5 levels of healthcare settings in the United States. We have disease prevention, health promotion, primary health care, secondary health care, and tertiary care. And within the levels of care are the type of services provided. Under preventative, we have immunizations and health screenings. Under primary, there's health promotion and education. Preventative and primary focus on health promotion, and they focus on reducing healthcare costs. Secondary health care is your emergency care or your acute medical surgical care. Tertiary care is intensive care. Secondary and tertiary focus on diagnosis and treatment of illness. Restorative is physical therapy or cardiac and respiratory rehab or rehabilitation to return a client to a previous level of functioning. And continuing care, which is such as assisted living or services for disabled or terminal clients. Again, there are several different issues that affect healthcare delivery. Nursing shortages, as I have said before, aging baby boomer generations. We also have aging nurses that are facing retirement, declining enrollment in nursing schools. Competency. It measures how well a nurse practices nursing and guides development of the nursing career. Evidence-based practice uses the best evidence in making decisions about client care. Quality and safety increases quality and safe health care delivery, improves financial income and client satisfaction. There's Magnet Recognition Programs, which is a national recognition program of excellence in healthcare. There are 2 in the state of Kansas, Stormont Vail and KU Med Center. Nursing informatics. Technology improves safety, communication, and documentation. And globalization of healthcare. We start off with improved communication and poverty levels. Patients are more knowledgeable, and nurses and physicians can practice across state and national levels. The poverty level remains the most deadly issue, more deadly than any disease. We also have cross-culture issues such as nurse migration. Many nurses from other countries are migrating to the United States to work. And there's increased travel and transport of goods from country to country that increases the risk of some diseases. Community nursing is a growing branch of nursing that's designed to meet the needs of a community. It takes healthcare to where people live and work, socialize and learn, and it reaches everyone in the community, including the poor and underinsured. Healthy People Initiatives looks at a community. They'll determine the healthcare needs, they'll gather information on those needs, and then develop policies and programs to help make positive health changes. In other words, they're looking at making a healthier or creating a healthier community that does not require such intensive nursing care. There's ongoing healthcare goals, and they're constantly being updated and changed. But the overall goal is to increase life expectancy and quality of health and eliminate health disparities. So what's the difference between community and public health nursing? Well, community health nursing is going to look at the development of health promotion and disease prevention programs. But look at your definitions here. Examples of public health nursing are going to be high-risk infants or Native Americans. Vulnerable populations are a group of clients that are more likely to develop health problems because of excess health risks, limited health care access, or dependence on others for care. Community nursing requires several skills. First of all, we have the caregiver, which once again is management and care for the health of a community. The case manager establishes a plan of care based on the assessments of the community in order to coordinate required resources and services. A change agent empowers the community to creatively solve problems or create change within the community. A patient advocate supports and defends clients' rights and decisions. A collaborator works in a combined effort with everyone involved in care delivery. The educator provides skills and knowledge to help the community learn to care for itself. A counselor assists clients to identify and clarify health problems and then assists the clients to choose an appropriate course of action. And an epidemiologist is always on the lookout for increased risk factors, tracking outbreaks, preventative teaching, and identifying problem areas. Nursing theories contain a set of concepts, definitions, and assumptions or propositions that will explain a phenomenon. Expertise in nursing is a result of knowledge and clinical experience. A paradigm is a pattern of thought that describes the perspective of nursing. It provides a link for the science, philosophy, and theories of nursing. A nursing paradigm will direct the activity of the nursing profession and contains 4 concepts: the person or the patient, health, environment, and nursing, which are essential to the development of theory. Now there are several different types of theories. We look at the grand theories, the middle range theories, and the descriptive theories, and the prescriptive theories. And then move on to interdisciplinary theories, which are specific to a particular area of practice. A systems theory is a systematic method of organizing and delivering nursing care. It follows the nursing process, or the nursing process is a systems theory. Basic human needs. Look at Maslow's hierarchy of needs. It helps prioritize nursing care based on basic human needs. Developmental theories is a description and prediction of human behavior and development, and it helps develop plans of care. And psychosocial theories explain and predict human responses in particular situations. We're going to touch briefly on several different nursing theories. Nightingale's theory, it's an improvement of client status by improving the environment. Peplau's theory is a development of the nurse-patient relationship. It has the phases orientation, working phase, and termination. Henderson's theory, which is what WATC's nursing program looks at, assists the client in activities that will improve health, recovery, or contribute to a peaceful death utilizing 14 basic human needs. Orum's theory increases the client's ability to meet his own self-care needs and manage healthcare problems. Leninger's theory is a provision of culturally specific nursing care. Betty Newman's theory is the assessment of the client's stressor and the response to the stressor and the implementation of the nursing process based on that information. Roy's theory is nursing care that's designed to help the client adapt to changes. Watson's theory, caring represents all factors the nurse uses to deliver care to the client. Benner and Rubel's theory, personal concern is an inherent feature of nursing practice. Noting of successful or unsuccessful interventions with a client and using knowledge to guide future care. Evidence-based practice makes appropriate changes in patient care delivery based on evidence that the practice is beneficial and will improve patient status. In other words, research. There's 6 steps of evidence-based practice. Number 1 is ask clinical question. Number 2, collect the best evidence. Number 3, appraise the gathered evidence. Number 4, integrate the evidence with clinical expertise and client preferences. Number 5, evaluate the decision. And number 6, share the outcome. A PICO question is designed to help you save time in the research process. Questions should lead you to the evidence for an answer. The more focused a question is, the easier it is to reach evidence. Nursing research involves 2 broad approaches for conducting studies: quantitative and qualitative. Quantitative offers precise measurement and quantification. It focuses on numerical data and statistical analysis and eliminates bias of results. Qualitative describes information in a non-numerical form. It involves inductive reasoning, and it's more philosophically based. Research process steps, again, identify the problem, design the study, conduct the study, analyze the data, and use the findings. Quality improvement monitors and evaluates processes and outcomes to identify opportunities for improvement and/or need for change. Performance improvement uses evaluation data to develop focused improvement actions.